I want to talk about tension headaches. They're incredibly common and often affect either the base of the skull, so often people will feel like they've got tension at the base of the skull, or it can radiate up and over towards the eyes. It's very common people spend a lot of time at computers or at desks, because if your posture isn't great, if your shoulders are coming forward slightly, your neck always ends up extending, and then those joints and those muscles at the top of the neck extend and get compressed and get sore, and when you're doing that for hours on end, those muscles get really tight. And the big muscles we're talking about here are the suboccipital muscles. So they're actually really small, but they go from the base of your skull to the top of your neck, and as we're extending up, they can get short, they can get tight, and because of their fascial and dural connections, which is sort of the connections of the muscle to surrounding connective tissue, they can then start pulling and causing, and when they get tight, they can cause that tension feeling, sort of being pulled back through the skull, and are often one of the reasons we suffer with tension headaches. So there's a few things we can do. Obviously, hydration and everything like that's hugely important for any type of headache, but more specifically for tension headaches is keeping your muscles loose in your neck. So I think stretching is really important. Most people when they stretch tend to stretch straight over to the side. Now this is a legitimate stretch, but it mainly just focuses on the scalenes, which are the muscles sort of coming down here. Personally, the one I prefer are the stretches that target the muscles that sit slightly posterior, so slightly further back at the back of the neck, which come from the top of the skull down towards your shoulder. So these stretches sort of focusing on your upper trapezius and your levator scapular muscles, I think are really useful and really effective. So for those ones, instead of going straight over to the side, what we do instead is we drop our chin, rotate towards our armpit, and then gently pull down in that direction to get a nice stretch coming through here. With those exercises, I tend to hold them for about 5 to 10 seconds and do it 3 or 4 times on both sides. The other thing that's really useful for people suffering with tension headaches is trying to release the suboccipital muscles themselves. Now, because these muscles are small, they're not very easy for you to stretch yourself, but the Manta foam roller is really good at getting into those muscles and helping to release them off. So we'll be using the central prongs, these central bits here, to get into those little muscles, to open up the joints, and also to stretch out and apply pressure to those muscles to try and help them relax and reduce some of the tension that's sitting at the upper neck and the base of the skull. So the easy way to do this is coming to lie on your back. We're going to have the foam roller directly underneath our skull. So you're having it quite high, just at the base of the skull, just above the upper neck. And what we're going to do in this position, all we're going to do is drop our chin down. So by dropping our chin down, we're elongating all the muscles at the back of the neck. We're opening up the joints of the upper neck, and the central prongs are really getting into those suboccipital muscles to help them release. What I would say is that I tend to bend my knees when I'm lying in this position, just to protect my low back, and we can lie in this position for minutes if you like, because it's a really gentle one but really useful for loosening and gapping all the joints in the upper neck. So I tend to stay like this for a couple of minutes, either focusing on my breathing or just sort of meditating and really getting into those muscles at the top. You can either drop the chin and just hold it there for a few minutes like I said, or you can gently nod to get into those muscles. If you want to make it slightly harder, just apply a little bit of backward pressure through the head to push the base of the skull more firmly onto the foam roller, and you can really feel the pressure going into those muscles, and it's sort of slightly uncomfortable, but it feels so nice at the same time. It's kind of a nice pain, and I would just stay like this for a few minutes, and then once you're ready, come up and move slowly. you'll find that hopefully if you do that, that once you're back upright, your head will feel a bit looser, there'll be a bit less tension through the upper neck, and hopefully any headaches you're suffering with will have eased off slightly. Give it a go, let me know what you think, and if you've got any questions, as usual, just reach out and ask.